Good afternoon, everybody. I wanted to share a couple of tips and tricks that I've learned having used the OP3D Pro and DTX Studio and DTX Diagnose for the last few months. A couple of things I've learned over the last, maybe a couple of weeks is that I'm preferring now more and more a less processed, less filtered image. So what you can see on the screen is a decent image. They look nice. We've got a little bit of scatter here, maybe some movement, some metal restorations that are creating a little bit of this scatter effect. But I'm discovering that I like a less dark image more and more as I start to really dig into and start to do my best to diagnose every root apex, all the sinuses and all the soft tissue areas that may be a concern. So I'm going to share with you a couple of tips and tricks that I found that I really like. So I'm going to jump back over to DTX Studio. I've got the test patient show pulled up here, move my face out of the way. There are a couple of things that you can do to change the settings that will make things process, in my opinion, a little bit smoother instead of that crisper, a little bit grainier image that we had just a second ago. So if you go over to the menu, click on your settings, which will pull up basically this interface that is your defaults. Go to image settings and turn off all of these. So for me, everything that was being processed was going through a 10% crisp image filter. So I deselected that, and I also selected this to show the unfiltered image in the DTX Studio Capture. So basically, I want the image to come through raw. I want the image unfiltered, looking at the capture screen once things are processed. So that's what I would suggest that you try. Now the good news is you can go back and you can change these. However, when you change this, if you turn these on, you'll have to restart your computer in order to, restart DTX in order to affect the change. So again, I leave all these image filters off just so that I get a raw image into my DTX Diagnose. All right, so let me move my head back over here. I'm trying to hide the patient information so I don't have any HIPAA violations here. And then we're going to switch back over to DTX Diagnose. So here's the image that we've acquired, and this has gone through the conventional processing, that 10% crisp filter like I pulled up a second ago. I'm going to change this. I'm going to bring this to where I feel more comfortable looking at it. This is a nice image, nothing wrong with this image. For me, looking through here, it certainly is helpful. I personally like a little bit less of a processed image though. So I'm going to click on this arrow down here, and incidentally this is also where you'll go to increase the sharpness of a panoramic x-ray. So click on the arrow. I'm going to turn off the crisp that you're seeing here. Turn this off. See how much smoother that is? Now watch, I'm going to turn it on and off. So it's less crisp for sure, but for me, my personal opinion is it's a little bit more diagnostic when it's less crisp and you're looking at soft tissue or potential swellings or an apices of teeth. So I turned off the crisp here and then I'm going to decrease the level. Now this is basically increasing the brightness. All right, so this is roughly where I like my images to look, to be from the standpoint of brightness. I feel like being able to see a little more of the, a little less sharpness, I want them to be a little smoother, gives me a little better feel for what's going on. For instance, let's look at this root apex. If I turn back on that crisp filter, you can see how it changes some of the darkness. Let's look at this PDL. Doesn't necessarily stand out. When I turn on the crisp, suddenly it's a lot darker. So in my opinion, sometimes these filters can give us a sense of a false positive. So I find, like I've been talking about for the last couple of minutes, if I decrease the level and turn off the crisp filter, it helps, in my opinion, that image to be a little more clear from a 3D standpoint.